On August 6th, last year, 2024, marks a defining moment for people living with grade 2 IDH-mutant glioma, if I'm saying that right. Today, oh, I got it. All right. Today I have Rachel, a patient living with IDH-mutant glioma, and Dr. Katie Peters, professor of neurology and neurosurgery at the Preston Robert Tisch Brain Tumor Center at Duke University. Good morning to both of you.
Morning.
Good morning, James.
Morning. Rachel, I got to ask you this. Can you tell us more about your symptoms and your diagnosis?
Sure. So I was at work and I realized I was having a lot of deja vu. And over time, it ended up that when I went to the hospital, I couldn't remember my name, I couldn't remember my birth date, etc. So they did a series of MRIs. I worked with a neurologist and I was diagnosed with a brain tumor. They immediately had to take it out. And once they took it out, they did genetic testing on the tumor itself. And I was told I had a particular kind of mutation called IDH.
Doctor, tell us about IDH, especially the mutant glioma, IDH glioma.
Yeah, so IDH stands for isocitrate dehydrogenase. This is a mutation that occurs in the primary glioma, which is a primary tumor just of the brain that occurs in adults. This is specific to the tumor itself, so it's not inside the person, it's in the tumor itself. So because it's a mutant and abnormal, we can target it with a drug such as Voranigo.
Doctor, tell us more about the FDA approval of Voranigo and what it means for those living with grade 2 IDH mutant glioma.
So because we knew about this mutation and it's specific to the tumor, the drug Voranigo was developed to really target specifically this mutation and can actually lead to suppression of the tumor and stop its growth. So there was a pivotal phase 3 clinical trial that was developed for patients like Rachel, that evaluated patients with grade 2 IDH mutant glioma whose tumor was detected on MRI imaging. And patients were randomized to receive either the drug Voranigo that targets that IDH mutation or a placebo. And in that clinical trial, they found that the patients that received Voranigo, they had a much longer time until their tumor changed or progressed. And not only that, the patients that were taking Voranigo were able to delay the use of other agents such as more surgery, radiation therapy, or even cytotoxic chemotherapy. So with this drug Voranigo, they were able to extend their survival, particularly their progression-free survival, and that led to the FDA approval.
Rachel, tell us more about your treatment journey.
Sure. So after they determined I had this mutation, they did what's called watch and wait. So for about a year, I had quarterly MRIs, which I still do, and worked with my neuro-oncologist just to check and see. And after about a year, the tumor started making a little noise. And so they asked if I wanted to be on the Indigo trial, which was sponsored by Servier Pharmaceuticals, of which I am a paid spokesperson. And because it was a triple blind, I didn't know if I was on the meds or on a placebo. So after about 2.5 years, the tumor started making a little noise again, and they unblinded me, and it turns out I had been on the placebo. So they put me on the actual drug, which is now Voranigo, and that's been about 2.5 years ago, and my tumor has been stable and quiet. So I've been able to go ahead and just live my life as normal.
Doctor, can you discuss the role of molecular and genetic tests in the treatment of this?
So it's really so important for patients to not just get a diagnosis of their tumor. And that's when we get a diagnosis, we look at the tumor underneath the microscope after a biopsy or after surgery, and essentially say, what does it look like? The next step, which is so key, is to look at the genetic underpinning of the tumor and understand its makeup. And this is where we can discover and identify that IDH mutation, which allows us to treat with targeted medications like Voranigo.
Doctor, where can our viewers go for more information?
So they can look at voranigo.com, and that'll give you more information on the drug and the benefits and risks. And you can also learn more about the pivotal Indigo clinical trial, which was the phase 3 clinical trial.
Rachel, you're a spokesman for this. When you talk to other people, what did they tell you about their journey?
So what I've heard, and I'm connected with a lot of different people in chat groups, et cetera, what I've heard is they've all had a very similar experience. They've been lucky enough, and with Voranigo and the amazing science, to have stable tumors and be able to, just like I said, continue to live their lives. So it's really been a life-changing intervention for so many people.
How does your family handle this?
Well, I have to say, when I had brain surgery, I had a team of people in the waiting room, and the big focus was on, is she going to be okay? Is everything going to, come out? And I was really lucky I came out with no deficits. And then since then, they've just been really supportive in terms of, helping me go to doctor's appointments, always asking about how things are going. But really, what I love about it is my family's treating me like normal. And so most days we don't talk about it, we don't think about it, and a lot of that is due to this new medicine.
So, Rachel, I guess you're saying it's important to have a support team.
Absolutely. You want people on your side, and you want people who are going to look at this as a disease and somebody who's going to be supportive, but also, again, treat you normally. We're just normal.
Yeah, I hear you. Been speaking with Rachel and Dr. Katie Peters. Thank you so much for talking to us on Morning Blend.
Thank you so much.
Thank you.